Welcome back. Tonight, doctors at Eisenhower Health say they have yet to see a true decrease in the number of coronavirus patients, but they're hopeful we're on the right track. I spoke with Chief Medical Officer Dr. Alan Williamson. Dr. Williamson, good to see you again. Thanks for joining us.
Peter, it's great to see you. Thanks for having us back.
How are things right now at Eisenhower? Is it any different since the last time we spoke?
Well, we continue to see a number of patients with COVID-19. It waxes and wanes a bit day by day, but it is not really going down. We're at a plateau where we're averaging roughly 20 patients per day in the hospital every day, each and every day. We're still able to manage that quite well within our capacity. We have typically 4 to 5 patients in the intensive care unit, many of whom are on ventilators, but again, fortunately, still well within our capacity to manage. But we're yet to see a true decrease in the number of patients that we're seeing.
Are you offering elective surgeries now?
We are beginning to reopen our operating rooms. That turns out to be a very complicated thing to do. We have some staffing issues because we did have to send some of our traveling nurses away when we weren't doing any elective surgery. We have issues with coordinating testing of the patients. We'd like to be sure for the safety of the patient and the staff that we're COVID testing all of the patients before surgery. And that's creating a few logistical issues that we're working through right now. But we hope to we're up and running now at roughly 50 to 60% capacity. And we're continuing to work through some plans within hopefully the next couple of weeks to really get back up to nearly full capacity again.
Dr. Williamson, we continue to get a lot of questions from viewers about face coverings. Should someone with asthma or who has difficulty breathing wear a face covering? Do they have to do anything different?
So I think that's a great question. And even for those of us who don't have any difficulty breathing, wearing a face covering, a face mask seems like it certainly invokes that feeling for us. So I think we probably have more empathy for those people that have trouble breathing. But the reality is, unfortunately, patients that have lung disease, whether it's emphysema, asthma, and so on, are at greater risk from the coronavirus. And so while it is sometimes difficult for them to breathe, I think it is important that they continue to do everything they can to try to avoid contracting this virus, including as much as possible wearing face coverings and remembering the basic things that we talked about long before we were really talking even about face coverings, which was to social distance, stay as far away from people as you can, avoid unnecessary trips outside of the home. Even as we hopefully begin to open businesses up, we need to be cautious for the high risk individuals, high risk groups, that they need to be extra cautious about getting outside of their homes and hand washing and avoiding touching your face.
How's your supply of personal protective equipment? Is there still a struggle?
I think we're doing pretty well with PPE right now. It is still not the normal supply chain that we're used to. We're still having to use some techniques to try to stretch out the use of the PPE as much as we reasonably can, but it is better than it was certainly. That's right now not fortunately the major hindrance to us conducting business as usual. Testing has become the next big challenge for us, is to really keep up with the demand and the desire on everyone's part to be able to test patients very aggressively so we really know who has this virus, begin to truly isolate the people that are positive, which is a normal public health endeavor in order to try to prevent the infection from spreading further. And for a long time, we were just having to test the victims of the disease rather than really trying to identify where the disease is right now, isolate those areas so that we cut down the spread of the virus throughout the community.
With the current cases that we've been seeing, are we on the right track? Can we improve?
No, I think we are on the right track. I think we did accomplish what the first goal at least was, which was to flatten the curve. That I believe we have done. The curve is flat. We're at a plateau. It is not going away. The next step will be understanding how we can maintain that and still begin to reopen our lives, get back outside of our homes, be able to open up restaurants, open up businesses. That's important. It's a necessary thing for us to be able to focus our attentions on, but we need to understand how we can do that safely so that we don't see a major surge as a result of doing that irresponsibly. So it requires a lot of work on everyone's part to understand exactly what that looks like and what the proper steps are in order to do that safely.
Dr. Williamson, great to see you again. Thanks for joining us.
Peter, thanks very much.